Hi everyone. It is great to see all of you here. First, I want to start by thanking everyone for having me at this important conference today. I hope that I am able to add some insight which may be valuable to you when interacting with patients that have developmental disabilities. My name is Amber Cutter. I have cerebral palsy. I am nonverbal and have been in a wheelchair for most of my life. But more importantly, I am a 33-year-old woman with a 33-year-old woman's hopes, dreams, thoughts, needs, emotions, and feelings. I aspire to become a counselor for persons with developmental disabilities, and I am working on my GED so I may enter the social services program. I'm a very dedicated member of my church. I have been playing power wheelchair hockey for the past 10 years. I am the only female goalie on the league and I have won several awards. I am a very strong member of the New Visions Advocate Group in London, Ontario. I advocate for myself as well as for others. I help to educate others about some of the barriers people with disabilities face and about the importance of acceptance and belonging for all. I have spoken to students in the Disability Studies program at King's College and to students in the Developmental Disabilities program at Fanshawe College. I love spending time with my family. I love to laugh and hang out with my friends. I love going for walks and playing video games and cards. I have a love for animals and have two bulldogs, Bailey and Bella. They are the best companions ever. I will be forever grateful to have met my true love. His name was BJ. BJ taught me what true love was and how it felt to truly be loved by another. BJ passed away from Niemann-Pick disease. He gave me hope for falling in love again and maybe one day being married. These are just a few things that make me who I am. I have a wonderful life and I feel very blessed. I would like to take you on a journey, and this journey is in your mind. I think this will give you the ability to put yourself in my shoes when I share some of my experiences with you. Please close your eyes and imagine. You have been bitten by a spider. You've been paralyzed from the neck down. You cannot speak. You cannot move. You can see and you can hear. As you lie in your hospital bed unable to move and unable to speak, into your room comes two nurses. They are there to change your sheets and give you a new gown. They've had a bad day and they are talking about their day. They talk about the long hours, hospital cots, not enough beds, and how the head nurse gets them to do all the disliked jobs. They talk about the doctors who don't appreciate the work they do. As they continue to bicker about their day, they talk to each other, but they don't talk to you. You lie there unable to speak, unable to move, able to feel, able to hear. One of the nurses takes out a bedpan. She puts it underneath you and says, "You need to use this now. It is uncomfortable and is causing you pain." You try to make facial expressions to let her know, but she doesn't seem to notice. After a couple of minutes, you use the bedpan and the nurse takes it and puts it back under the bed. They finish changing your bed and your nightgown. As they're leaving and continuing to talk about their day, you realize your nightgown is riding up above your waist. You are exposed. You lie there, unable to speak, unable to move, able to hear, able to see. A few minutes later, in comes a janitor cleaning the floor. He looks at you in the bed with your nightgown above your waist. You lie there unable to speak, unable to move, able to see, able to hear. As he comes closer to you, he reaches under the bed and takes out the bedpan that you've used and goes to the washroom and flushes it down the toilet. He comes back and puts the bedpan under your bed and looks at you one more time, saying nothing. The janitor then slowly sweeps the room and leaves as you lie there, unable to speak, unable to move, able to see, able to hear. After a few more minutes, your doctor comes in and with him come a group of student doctors. They gather around your bed because your case is unique. The doctor discusses your chart. No one speaks to you. After looking at your chart for a few more seconds, the doctor leaves the room with all of the student doctors following. Again, you are alone, unable to speak, unable to move, able to see, able to hear, able to feel. You can open your eyes now. How do you feel? Did it make you feel invisible? My first experience of feeling invisible that I remember well was around the age of 7. I was in a meeting at school with my teachers, my therapist, and my parents. They were talking about my goals. Let me say that again. My goals. The problem was that they were not talking to me, but rather about me while I was sitting right there. My mom, who is my biggest advocate, spoke up and said, Amber can communicate verbally with some words. We should try and concentrate on working with her on her verbal communication. The therapist replied, we don't have time for this, so get on with it and get over it. I understood what that therapist just said. My parents and teachers got up and left the meeting. Everyone there was so offended by this lady. This was a very devastating experience for all of us. I felt defeated and very invisible. Situations like this have happened too many times to count. Given my health complications, I am a high-risk patient. Throughout my countless visits to the hospital, I have had numerous operations and hospital stays. I do want to stress that I have had excellent nurses as well as excellent doctors in my life. I have experienced good and bad from different medical professions. I have had a few horrendous experiences to share with you in hopes that it will make you understand the importance of how a patient with developmental disabilities feels when these incidences take place. I will also share some of my experiences that have been very positive. One of the biggest issues I would like to address is how medical staff tend to address and talk to the parents or the person's support staff as opposed to talking to their patient. This is something that has happened to me numerous times. Doctors address my mother or my father instead of me. This can be very upsetting and demeaning. If I don't understand what you are telling me, I will let you know and ask for clarification and look to my support for assistance. I am nonverbal and have a disability, but it should not ever be assumed that I don't understand. I have had interactions with medical professionals where they asked my support workers questions instead of asking me. Sometimes I might need my support to help me with answering questions, but I am capable of answering many things for myself. Talk to me and ask me first. If I need help, My support worker will help me, but please don't ignore me. I have found myself wondering if doctors or nurses understand the impact that this has on a person. Being ignored when you are in the room truly makes you feel like you have no voice. It can feel very degrading to be treated this way, to feel like your healthcare provider cannot take the time to speak to you directly, or to ensure that you personally understand the circumstances that you are facing. Sometimes this means having people who know you best assist with ensuring the information being given is understood. While meeting with the doctor about my thyroid, the doctor was explaining options about the procedures that could be done. My mom and I were having trouble understanding what the doctor was saying. My support worker went to clarify, and the doctor told my support worker that it wasn't her place to talk. My support worker was only trying to help, and the doctor's dismissal was very rude. I would like for medical professionals to realize that if a person is not understanding the information, our support workers are there to help translate the information for us. They work with us regularly and can tell if we are understanding or not understanding. As you can imagine, I have had a lot of blood work done in my lifetime. I know that the nurses always have a hard time drawing blood from my arm, and they end up having to use my hand. I tell them this every time, but they always dismiss me and try my arm first when I know they will have to restart by using my hand. I feel as though they aren't listening to me when they go ahead and try my arm after I have told them to use my hand. This can be so frustrating and very painful. Another example of this was the time I had to go to the emergency room. When I get a cold, it is often accompanied with aspirating pneumonia. My mom explained my symptoms to the doctor. She explained that I have experienced these symptoms several times before, and that it is my body's way of letting me know I am about to get a cold, and it is sometimes accompanied with aspirating pneumonia, which usually causes my temperature to rise, etc. The doctor did not take any of the information my mom was telling him into consideration and told her he was going to do a CAT scan. I said no to the CAT scan, and so did my mom. She explained again, this is just my body's way of telling me I am getting a cold. The reason for why my mom and I didn't want me to have a CAT scan is because I've had so many in my life, and we really didn't feel it was necessary. When my mom left the room to use the phone, she came back and I was gone. The doctor went ahead and took me to have the CAT scan. He came back after the test and said we can't find anything. So I'm assuming she's just catching a cold. The problem with this is that I used my voice and said, no. My mother used her voice and said, no, and we were completely ignored. I realized that we are not doctors. We don't know your jobs, but I do know my body. I've seen this happen a lot of times, so I knew what was about to happen. Sometimes I wish doctors would try and listen. You see, he never checked my lungs. He never checked my ears. He never checked my throat. He never checked my temperature. Nothing was checked. I went directly to have a CAT scan. I understand that the CAT scans have to be done, but I believed that I didn't need it done. I just wish he would have taken the time to listen to what I had to say. Another time, I had just come out of surgery. My mom, who like I mentioned, is my biggest advocate, was waiting with me in the hospital room. The nurse came in and told my mom she could not be there. My mom tried to explain that I am nonverbal and that I would not be able to hit the call button on my own if I needed help, and that she was there to assist. Regardless of this, the nurse continued to tell my mom that she had to leave. The nurse was rude and aggressive. I began to cry as I was quite afraid of being in that situation without my mom. The nurse reluctantly agreed to allow her to stay but made it clear that if she was to do so, she would have to sleep in a chair. My mom stayed and slept in that chair all night. I found myself wondering why somebody that went to school to help others is being so difficult and making this experience so much worse for both of us. I felt so upset and sad following such a horrible experience. Thankfully, the next day a new nurse came on who was lovely. She talked to me directly, made me feel good, and was very kind to my mom. The last unpleasant experience I am going to share is when I was getting ready for another surgery. My mom tried to tell the prep nurse that I had been aspirating for a few days prior. The nurse again ignored my mom as if she wasn't there. I remember my mom crying while they took me away to surgery. Following this surgery, the doctor said I could go home. I was trying very hard to tell him that my chest hurts. He ignored me. My mom then had to intervene as I was not being heard. She said, "Please check her. She's trying to tell you something. She is trying to tell you that her chest hurts." Surprisingly enough, I had aspirating pneumonia. Had the doctor taken the time to listen to me, he would have known this. I can't even imagine if my mom, who is my advocate, was not there. This truly could have turned out a lot worse. My mother is my voice when I am not able to speak for myself. She can't always be there for me, and someday she won't be. My goal is that we start to change things, including the way medical professionals interact with patients like me and our advocates. All persons with disabilities have a right to be heard and to be respected. We are all different, different shapes and sizes, abilities and support needs. We all have different experiences, but please do your best to allow people to try and advocate for themselves regardless of their abilities. They will ask for help when needed. I realize our healthcare systems are under a lot of stress. We have a lot of shortages, but never make that be your excuse to not talk to your patients and to listen to them. What I would like you all to take away from hearing my experiences is, don't make assumptions about a person's ability. Speak to your patient regardless of their level of understanding. And people may have support accompany them to bridge this gap in communication. While it is important to speak directly to your patient, it is also important to listen to the person's support worker as well. They are trying to help you. Listen. It may take a person with a disability a bit longer to process the information and/or formulate an answer. Be patient and listen. Please treat everyone with the respect that they deserve. As I said, I am an advocate, not only for myself but for others with developmental disabilities. Situations that I have experienced are also shared by others. This is something that we see and deal with far too often. Think back to the journey I had you go on. Imagine for a second going to your doctors and having them not listen to your opinion, ignoring you, and only concentrating on what your husband or your wife has to say, as opposed to them speaking to you directly. It is not a feeling I would wish upon anyone. All I ask is that you do your very best to communicate with people directly, regardless of their abilities. Learn to listen even though it might take some extra time. You just might learn something and make a new friend in the process. I do want to stress, though, that I have had excellent nurses as well as excellent doctors in my life. But I have had a couple horrendous experiences that I hope have given you a better understanding about the importance of how a patient with developmental disabilities feels when these incidents take place. I truly hope that after listening to this, it can assist each and every one of you with understanding your patients with developmental and physical disabilities a little bit better. I would like to finish up by talking about two great doctors that I have met. The first one I met was when I was in the hospital. I met this amazing doctor who took the time to speak with me directly. I told him that I was going to die if I continued aspirating. It was such a breath of fresh air when he took the time to talk to me personally. In fact, he told my mom not to talk. He wanted to hear from me. He went as far as to give me my phone and told me to type in what I needed to say. Shortly after this conversation, his medical team came to see me. 2 hours later, I was having my G-tube changed to a GJ. I am beyond appreciative of that doctor. I'm doing much better because he decided to take the time to listen to me and do what he knew was best for me. Another excellent doctor is the one I see at Parkwood Hospital here in London. She is a CP specialist and she is an amazing doctor. She takes the time to ask me questions and truly tries her very best to communicate with me. She always does her best to make sure that I am comfortable. I am so grateful for all of her support. Never once have I felt invisible around her or her staff. Yes, I have cerebral palsy. Yes, I am nonverbal. Yes, I have been in a wheelchair for most of my life. But my disabilities should not be a reason for people to assume that I do not understand or that I am incapable of expressing my thoughts, feelings, and ideas. In closing, I want to say thank you to everyone for having me here and for allowing me to share my experiences. I hope in the future, when interacting with patients who have developmental disabilities or are nonverbal, that you stop and take the time to address your patient and to listen to their advocate as well. Thank you.